postdocs, so formerly at the University of Sydney, and are shifting to a new postdoc. And as the audience will be able to see by his facial hair growth, his primary role at the moment is looking after his young child. So Ben, it is off to you.
Excellent. Cheers, Damien. So I'm actually on holiday at the moment, hence part of the facial hair growth. And one of my favorite sort of lockdown activities or holiday activities is to play some super nerdy board games. And traditionally, one of my favorite board games to play was actually the board game Pandemic. For those who haven't played this exquisite piece of art, Pandemic is essentially a cooperative board game. And how it works is you work as a team to try and control disease outbreaks that have occurred across the world, and you start trying to work out a way to control the virus before it gets out of hand. Now, how this works is every player gets to play a different character, and every character has a different skill. So there's a medic, and how a medic works is they can remove all the diseases on a city in one turn. A dispatcher who can move other people to places so that they can get to the virus outbreaks faster. And then the quarantine specialist who pretty much protects every major city she touches with her magical powers of social distancing and her ability to convince people to grow sweet ISO beards. And I'll admit that while this game, as I mentioned, is this exquisite piece of art, I have not played it during the COVID-19 pandemic, largely because it hits a little too close to home. My main critique of the game following experience with an actual pandemic is it is brutally overly simplistic. Sure, as was mentioned earlier, we've got some amazing leaders and researchers and scientists who play a really critical role in controlling the virus, but the game also massively overlooks a heap of key players in the game. For example, you've got your conspiracy theorists, your anti-maskers, and like literally everyone else. Citizens who have actually had a massive role in this pandemic and had a heap of responsibilities to, stay at home and keep others safe. And it's these everyone else's that I want to talk about in this talk and who we've been focusing on in this session. Because it hasn't been easy playing this role of an everyone else in this version of pandemic. And we've faced some pretty key challenges and made massive sacrifices to keep everyone else safe. We've socially distanced, we've learned to Zoom, we've worried about jobs, worried about finances, we've worked at home with kids, and we've grown those sweet isolation beards. And we've also done all of this while worrying about the threat of a deadly virus. And it has been really hard to ignore that threat. Even if you try and go on a social media or a media, shutout, it's hard to avoid the news. And for some of us, we've been frantically checking the news and the media sources. As was mentioned earlier, you can see what's happening in Italy and New York, and it has been a terrifying experience. And for some people, they have reported experiencing more fear than others. And our group, and at least in this talk, has been particularly interested in what role the fear of COVID or the fear of the virus may actually have on health and well-being in New Zealand. So I'm going to pull out two of our studies that we've been running over the course of the pandemic and talk a little bit about the role of fear of COVID and well-being. The first study I want to focus on is a cross-sectional survey we've run with a sort of a general sample of New Zealanders. We recruited about 2,420 people during these simple cross-sectional surveys. And then the next, I want to actually talk about a longitudinal study where we've been tracking young adults over the course of the pandemic. Luckily enough, we had a sample that we'd already been tracking for all of 2019, and we just pretty much pivoted some of our research questions and continued to track them throughout this year and managed to get surveys done at essentially pre-COVID level, immediately post-level 4, immediately post-level 3, and then again at level 1. But first, some of you may be wondering, what is the fear of COVID and how do you actually measure it? The good thing is that, like all things psychology, there is a scale for that. So the fear of COVID is a 7-item measure that essentially asks an individual to mark the extent to which they fear COVID-19. So the questions will be like, how much do you agree with statements like this? It makes me uncomfortable to think about COVID-19, or I get nervous when I watch the news about the virus, or my palms get sweaty when I think about the virus. And our team actually did some work to validate the English version of this paper. I think it's been translated in like 35 different languages now. But Taylor led our English version of validation of the paper. And Taylor, for those who didn't miss the morning session, he talked about some of this research there. And he is definitely a PhD student to watch. So keep an eye out for Taylor one day. Anyway, first I want to talk about some of our cross-sectional studies. And for these, I want to focus on, firstly, who fears COVID? And secondly, do those who report a higher level of this fear of the virus actually report poorer well-being as the virus sort of ticks on? And so to do this, we had 2 online surveys that we pushed out during alert levels 4 and 3. Pretty much we threw these up on social media and pushed this as hard as we could through our networks. We used Damien's fame to do some interviews to try and get this into the media, to get people to do our very cool surveys. And it turns out that Damien's actually pretty famous. At level 4, we had about 1,400 people completing our first survey, and then another 1,023 at level 1, which is good. And Taylor's done a good job of talking about some of this data this morning. So for this, I'm only going to focus on gender, age, the fear of COVID, and our well-being scores. So firstly, we did find that women tend to report higher level of fear of COVID than men. We also surprisingly found that younger adults tended to report slightly higher levels of fear of COVID than those who are older. This was actually a little bit surprising. We sort of thought that older participants might report a higher level of fear, given that they're sort of more at risk than the younger counterparts. And obviously that's not what we saw here, a slight negative correlation between the fear of COVID and age. We also wanted to probe, like, okay, well, is this link between these 2 variables moderated by age or gender? And even though I've sort of put a very misleading slide up here, sorry, I missed this. Look, there's age. Next, looking at well-being, we also found that there was this negative link between the fear of COVID and well-being. So as people reported higher levels of fear of COVID or fear of the virus, they also reported lower levels of well-being. We were interested here in looking at whether this link between these 2 variables was moderated by either gender or age. And even though I've kind of put this very misleading slide on here, we did not find that age or gender moderated the link between fear of COVID or well-being. So to sort of briefly summarize, women and younger adults tended to report a higher level of fear of COVID. Taylor reported this morning as well that those who tend to be more liberal also tend to report higher levels of the fear of COVID. And then finally, we also found this negative correlation between well-being or mental well-being and fear of COVID. One issue, however, with this is that obviously we can't look at the temporal link between mental well-being and fear of COVID because it was a cross-sectional study. And this kind of nicely leads me on to this next study, which is our little longitudinal study tracking young adults as the pandemic progresses. And our aim here was to look at, do young adults see sort of poorer well-being outcomes when we track them as the pandemic continues? And more importantly, because the last group already did a great job of this, what role does the fear of COVID have in this? And so, as I mentioned, we're fortunate enough to have a group of young adults who we've been tracking since 2019. The aim of that study was to look at health and well-being amongst university students when they transition into university. So this is a group of 227 students, a lot of whom are starting their second year at university. Some of them have sort of branched off to bigger and better things, and a lot of them were at the University of Otago. And the surveys that I want to talk about here is we've got an end of 2019 survey that I'm going to call our baseline. We've got the end of level 4, where essentially we asked people to retrospectively report on their experiences during lockdown level 4. Same with level 3, and then a couple of weeks into level 1, we also asked people to report on how they were going during level 1. And the variables I want to talk about here are gender, age, depressive symptoms using the PHQ, positive and negative affect, and then alcohol use, which Damien's not going to be stoked about, but it's way too interesting not to talk about. So firstly, looking at the fear of COVID as we move through these lockdown levels, we were relatively surprised that the fear of COVID stayed pretty stable between each of the lockdown levels. We did sort of think this may dip off when we sort of hit this level 1, and we kind of speculate that the reason for the fact that the fear of COVID not decreasing is that the virus is still here, and we are still a little frightened of it. We are still checking news. And so we suggest that that's the reason why, even though we've moved between these alert level lockdowns, we haven't seen a decrease in the fear of COVID. I should also point out, we don't have a baseline measure of the fear of COVID, which would normally go here. The reason for this is that at the end of 2019, we didn't know that we should be measuring this variable. So mad apologies there, but just assume that it's kind of down here. We did, however, have depressive symptoms measured by the PHQ at each alert level and baseline. And although this graph doesn't show a massive change, we did see an increase in depressive symptoms between baseline and level 4 and baseline and level 3 before it lovingly came back down here at level 1. Now, again, the aim of this talk isn't to sort of talk about those changes, but to highlight what role the fear of COVID may be having in mental health and well-being. And so to do this, we ran a number of generalized linear mixed models to account for the fact that we have observations nested with participants, and we've got these different time points. And so we wanted to have a look at really what role the fear of COVID played here, and aim to predict depressive symptoms from while controlling for things like gender, age, and baseline depressive symptoms. So essentially, we're aiming to see, does the fear of COVID have an impact on depressive symptoms over and above sort of these baseline levels? And we found, at least in this study, that that those who reported these higher levels of fear of COVID did indeed report greater depressive symptoms. So at least for us, we sort of tentatively concluding that the fear of COVID may play some role here. Next, I briefly want to talk about positive affect as it's changed between alert levels. We also don't have a baseline for this. I don't know why we don't have a baseline for this. Something I might hassle Damien about later. But looking at the graph, we do see that there was not much of a difference between sort of level 4 and 3, but there is an improvement or people are more likely to have higher positive affect during level 1. So for this is the PANAS. Essentially, people are asked during those lockdowns, in the past 2 weeks, did you feel positive, strong, or excited? So people at level 1 were more likely to report that they felt positive, strong, or excited more often than those other alert levels. Looking at the role that the fear of COVID plays here, though, we actually found that there was no impact on the fear of COVID on positive affect. Looking at negative affect, we again sort of see this similar trend, but the opposite. Negative affect was higher between level 4 and 3 than it was level 1. And we did, in this instance, see that those who reported these higher levels of fear of COVID did tend to report more negative affect when we control things like gender, age, and time. And then finally, Damien's told me not to talk about this, but as I said, this is by far the most interesting variable in the data set. This is alcohol use at each time point that we have it. Now, there was a massive, so I work in addiction medicine at the University of Sydney, and there was a massive concern at the start of this pandemic that we were going to see a really big increase in alcohol use. We'd seen a lot of panic buying at the start of the pandemic in both New Zealand and Australia. We were worried that people were going into lockdown where they may have more time than ever to drink. Stress levels were pretty high. And at least with some of the studies we'd been running, looking at online advertising, we saw an increase in online advertising that focused on the fear of COVID or panic buying and suggesting that people needed to stock up or recipes for quarantinis. And so we were concerned about this because with an increase in alcohol use, you typically see an increase in alcohol-related harms, and that can place an additional stressor on a healthcare system that's sort of gearing up to deal with COVID. We were also concerned that people may hurt themselves because of their drinking and then not go into hospital because they didn't want to catch COVID. There was an outbreak. And so we were particularly concerned about alcohol use. However, in the young adults, at least in our sample, this was not what we saw. In fact, if anything, we saw a reduction in alcohol use to the point where they're pretty much bottoming out here at level 3 and 4. So these are university students. Drinking is typically very social and very, very normal. But as we see, there is this difference between baseline and level 4 and then level 3. And then it's starting to come back up at level 1, likely as they start getting their social lives back and start to drink. So looking at the role that the fear of COVID may play here, so these mixed models, but taking into account the fact that this is a count variable with a large number of zeros, so these are zero inflated negative binomials, we pretty much found that the fear of COVID did not predict alcohol use, at least amongst this group. So it didn't predict either an increase in alcohol use or the presence of any alcohol use. So to briefly sort of wrap up, what we found was it did appear to be a role that the fear of COVID was playing in poor mental health and well-being. In the second study, not necessarily for the positive affect, but we did find this was depressive symptoms when controlling for baseline depressive symptoms. We still have a few more things to run with the student sample. So I only got this data a couple of days ago and I'm still sort of playing with it. We've got another things to sort of build into our models. The thing that I think is important that we need to take into account is the social context. So for these, most of these guys are at university. A lot of them were flatting this year, which is a super social experience. They've moved in with 4 or 5 other mates and are living on Castle Street for the first time, and it's all exciting. And a lot of them moved home during alert levels 4 and 3. And so we want to look at the role that may be having, or whether the number of people they're locking down with can have an impact on their health and well-being. And again, looking at the role that the fear of COVID plays there. So there's still a bit of work to do here, and we're still sort of finalizing our models. And then finally, looking at the fear of COVID and alcohol use, I am really interested in this. Although we didn't see these changes for young adults, I do think this may be different in older populations who are not predominantly drinking for social reasons. And so that's something that I'm kind of excited to explore a little bit more. So unfortunately, the pandemic is not quite over yet. And so the fear of COVID may change as we kick on through this pandemic, as we see additional outbreaks, or as we maybe even get bored and tired of the virus and decide that, fine, we're just living with it, it's no big deal. And so fear may change as we continue to kick on. And so it's our job to continue to monitor that and continue to look at the role it is playing in mental health and well-being in New Zealand. So that's pretty much me. Everyone stay safe, look after each other. And if you do feel bored, I think the game Pandemic is well worth trying. And it's about $10 in the App Store. And so I'd highly recommend getting into that. Thank you.